Thank you for joining us for this special edition of KPBS News. I'm Maya Trabulsi. This is the week California announced a $6.5 billion plan to reopen public schools as soon as April. And Friday morning, the state loosened restrictions on youth sports. A big reason for this progress is the steady downward trend of new COVID-19 cases. Numbers released this week by county health officials show where we are. Most days are now well under 1,000 new cases. Hospitals are getting a break as patient loads are dropping. San Diego County now has more than 3,100 total COVID-19 deaths, which are also trending down. Taking on a new leadership role with the county this year, Supervisor Nathan Fletcher delivered this week's State of the County address. As you might expect, COVID-19 dominated the annual message to San Diegans.
Good evening. I come to you tonight from the county's Emergency Medical Operations Center. 370 days ago, our county was one of the first in the nation to declare a public health state of emergency on COVID-19, activating this site and others to respond. From this modest warehouse, our region's massive mobilization was equipped. Masks, ventilators, testing supplies, PPE, and now vaccines. At its heart,
beyond the usual theme of laying out an agenda for the year ahead, Supervisor Fletcher made some news in announcing law enforcement, grocery workers, and teachers will be among the next group of eligible for vaccines. Fletcher says that will begin March 15th. Also of note, Thursday night, plenty of tributes to healthcare workers, including the national anthem performed by one of the nurses at UC San Diego Health. Healthcare workers of all stripes are meeting the moment in ways big and small. As the number of vaccinated in San Diego steadily rises, KPBS got a behind-the-scenes look at the work required to get a center up and running. Here's KPBS health reporter Taryn Mento.
The neon duct tape Victoriano Diaz lays on the ground is not an arbitrary decision.
Regular tape is going to get dirty. You're not going to be able to see it on this pavement once people start standing on it. So fluorescent tape seems to work well for us.
It's a tip picked up after nearly a year of ushering socially distanced crowds through COVID-19 testing sites operated by Family Health Centers of San Diego. The nonprofit is the largest network of community clinics serving San Diegans,
where we'll have a patient wait in line.
The carefully spaced spots will safely direct up to 750 daily visitors to a COVID-19 vaccination. But Diaz and his team must first draw out and plan out every detail before the first dose.
There's all kinds of small little idiosyncrasies that people aren't aware of that we need to plan for. So simple things like your vaccination card. Like where is this vaccination card going to be given to the person and who's going to write it?
This meticulous planning of a site is critical to reaching San Diego County's vaccination goal. Officials say every shot counts to vaccinate 1.8 million San Diegans by July. And community clinics are key to reaching underserved communities most affected by COVID-19.
So this is an aerial shot of our Logan Heights Family Health Centers, which is our largest site that we're going to be providing vaccinations.
Half of the rectangle lot already holds a testing site. The team must plot out how to weave vaccine recipients through 4 zones designed to control bottlenecks.
So we want the patient to still have a good experience. We want them to just be standing here waiting. So we want them to have a seating area that they're going to wait. If we do have to take a little bit more time with the patient, we're going to give them that vaccine.
But Diaz is already planning for long lines stretching along the sidewalk, like they saw for testing.
We would have 50 to 60 people that were here at 5 o'clock in the morning.
The clinic zip code has one of the highest rates of COVID-19 infections in the county, but the site, with a clear view of the Coronado Bay Bridge, is also in an area that has the lowest vaccinations.
So we're looking at maybe having a couple of different points of where people are going to be standing. So maybe this side of the fence might be patients that are going to be scheduled for that first hour, and then maybe on that side of the fence there'll be another line for the patients to be scheduled for that next hour.
They also need to recruit and train the volunteers that will pre-screen, register, and guide patients through the orchestrated maze. And they'll have to develop a system to track the 15-minute observation period for dozens of patients with various vaccination times.
Who's going to be clocking the 15 minutes when people are sitting down, and how do we know that person 15 minutes just started.
And they have to find secure storage for supplies when not in use.
You know, there is talk about maybe putting a storage shed on site also to store non-medical supplies, because that's another consideration, is how much equipment that we need to have there.
Each day they'll reflect on the lessons learned, because they have to make sure every single daily patient returns in a few weeks for their second dose.
We're going to come up to the chair and we're going to introduce ourselves, thank them for taking the time and the courage to get their vaccine today.
The extra focus on patient experience is what Diaz hopes will bring them back for round 2. The site was set to launch early next week, but they received word on Thursday that the incoming vaccine supply wouldn't be enough. Family Health Centers hopes shipments from the Biden administration's new program will reach them the week after next. Taryn Mento, KPBS News.
If you're looking for a site that's close to where you live, KPBS has you covered. We have a dashboard at kpbs.org where you can find a map of sites from North County to the South Bay. We're also tracking the progress toward getting our population vaccinated. You can get to the vaccine dashboard through the Tracking COVID-19 link at kpbs.org. It can be hard to get to a vaccination site, especially for seniors and those in underserved areas. Bridging the gap is important work. That's why first responders and a special group of community members are making a difference by reaching out to residents face to face. KPBS reporter Matt Hoffman has these stories from the South Bay and City Heights.
Okay, congratulations.
It's great. I mean, it's wonderful to have this service done here for all the seniors.
The Chula Vista Fire Department is bringing vaccinations directly to South Bay seniors, part of an effort called Operation Immunity. Captain Linda D'Orsi is with the Chula Vista Fire Department.
Well, they might not otherwise get their vaccination if we didn't come to them.
Wednesday, crews were at Terry's Mobile Home Park in Chula Vista, where some say they were worried about where to get their shots.
I just appreciate, they come here and help us out, so we don't have to worry about go somewhere and, looking for transportation. A lot of people can drive over here, the people who live here.
Teams were prepared to deliver around 200 vaccinations.
Are you ready for the phone?
That was great for all this community, because most of them, it's, this park is 55 and older. So we're here elderly people.
Okay, that's it.
What? You already did it?
Yeah.
The program recently started and is a partnership between Chula Vista Fire and the county. Crews are hitting different apartment buildings, and they are even doing vaccinations to homebound seniors.
No, we definitely wanted to get involved. We wanted to be at the forefront. We're one of the first to do this. We've done at least five separate complexes. And we have more slated on the calendar to do, so we're trying to make it out to all of them depending on how much vaccine we are given.
Paramedics are delivering shots, and EMTs are currently being trained to expand the ranks of vaccinators. Homebound seniors over 65 in Chula Vista can call 619-476-2397 to schedule an appointment for a vaccination. Matt Hoffman, KPBS News.
It's very grassroots. Moms, neighbor to neighbor.
Miriam Rodriguez with the San Diego Latino Health Coalition has been working as a promotora, or community health worker, in City Heights for 15 years now.
Promotora work is so important. It's part of our culture. You are welcome. You're here. How can I help you?
Gracias.
Latinos make up the majority of coronavirus cases in San Diego County, but they are not getting majority of vaccinations. Officials hope that by sending teams out to areas like City Heights and the South Bay, that will change.
We go to different supermarkets all over the county, all the promotoras. Not only are we listening to each other, but we're encouraging them. Hey, I already had the vaccine last week. I'm feeling great. Go ahead. Do you need help signing up? Can someone in your family help you sign up?
Rodriguez says she is hearing some fears about the vaccination and potential side effects, but she says many here want to know when a large-scale vaccination site will be coming to City Heights.
When is it going to be next for our people? Because they're ready. They want to do it.
Rodriguez says some people in this area do not have easy access to transportation, so officials have to bring vaccines to the community. She also says not everyone is on social media and some seniors are not online, so taking the vaccination message directly to them is key.
We share our own experience, and then we let them know as well, hey, this is a flyer so you can know more in your language how the face is, but at the same time, call me. Send me a message. I'm here for you.
The San Diego Latino Health Coalition is one of many groups working to make sure everyone who is eligible for a vaccination appointment is able to get one.
We just want to make sure that they are actually getting the information because they might not be getting it, and we're trying to close that gap.
Sanitizers, masks, and wipes.
The Chicano Federation is also sending out teams across the county to deliver vaccination information. They are also continuing to hand out supply kits with masks and sanitizers via appointment only. Seniors 65 and over, plus healthcare workers, can book vaccination appointments through the county's website. Matt Hoffman, KPBS News.
Extreme weather across the U.S. disrupted vaccine shipments to San Diego this week. Keeping up with supply and demand is a challenge here and around the world. Anna Stewart has more on the rush to produce billions of vaccine doses.
This lab is making lipid nanoparticles. The genetic code in mRNA vaccines are transported into human cells via these little fatty bubbles. Around 1,000th of the width of a single human hair, they're incredibly small, critical to the COVID-19 vaccine rollout, and there aren't nearly enough. Acuitas Therapeutics is one of the biotech firms making the lipid component in the Pfizer-BioNTech vaccine. They're also supporting CureVac and Imperial College London, who have vaccine candidates in the pipeline, but they can't make enough by themselves.
We don't try and do it all ourselves. We try to enable others around the globe to be able to contribute to this effort. Whenever we reach out to other companies to ask them whether they could support manufacturing of the lipid components, for example, as soon as they hear it's to support a COVID-19 vaccine, they're completely engaged.
Powerful alliances are being forged in the private sector. There are calls, though, for more cooperation at government level.
Now we are facing a situation where overall capacity, whether it's for the first steps of manufacturing or it is for fill and finish, they are scarce. And as a result, we need public agencies, so governments nationally or regionally, they have to come together and ask the question, if I have scarce capacity for something, how do I ensure that it remains coordinated between multiple vaccine manufacturers?
Greenlight Biosciences, a biotech firm in Boston, has delayed the development of their mRNA vaccine candidate so they can tailor it for the newer variants of coronavirus. It'll also allow them more time to increase capacity.
Greenlight has been looking for multiple facilities. We are in conversations with multiple regional partners in South Asia, Southeast Asia, Africa, North America, South America, to implement those facilities. Those facilities will take roughly 6 to 9 months to construct, and then they need to be validated by local regulatory authorities, which adds anywhere between a month and 3 months or whatever. But once each one of those facilities is up and running, they will be able to produce billions of doses of COVID-19 vaccine locally.
If you see other vaccine makers fail to make a vaccine, fall out of the vaccine race, are you looking to buy up their facilities as well to ensure that you can make as much as possible?
We're looking for a GMP facility. We're looking for local partners. So that's my wanted ad on CNN is can we please, if you have spare capacity or you want to participate in getting local production up and running, please give us a call.
Vaccine factories and lipid nanoparticles are just some of the bottlenecks to vaccinating the world. There will be more. Not least as new variants of coronavirus require modifying vaccines, and perhaps for years to come. Anna Stewart, CNN, London.
While science has been the primary challenge during COVID-19, many are still hurting economically. The county's second largest city will spend $16 million to help people with rent and other bills. KPBS reporter Max Rivlin-Nadler tells us who will qualify.
The $16.8 million comes from a mix of state and federal funds meant to help pay the day-to-day bills of people in a city hard hit by the COVID-19 pandemic. Chula Vista Mayor Mary Salas announced the relief fund will help not only cover past or current rent, but also utility bills.
Many have struggled to pay the rent, gas, electric, water, and sewer bills. Some have been faced with these hardships for the first time ever. These funds can help those who meet the eligibility requirements to get those bills paid.
Currently, an eviction moratorium in the state protects most renters from eviction over non-payment. But back rent continues to pile up for renters, and there have been no similar programs for those who have fallen behind on utilities. The city of Chula Vista has set up a website for those seeking assistance to see if they qualify, and a call-in line for those without internet access. Residents can sign up for notifications about the program at chulavistaca.gov/tenant help. The County of San Diego has its own separate rent relief fund, which is meant to reach county residents who live outside of cities like Chula Vista, which have qualified for direct aid from the state and federal governments. Max Rivlin-Adler, KPBS News.
Food insecurity is another area of need, and the demand hasn't let up for organizations like Feeding San Diego. Jacob Ayer visited a recent distribution that helped hundreds of hospitality workers.
Cars lined up at Pechanga Arena Monday for Feeding San Diego's emergency food distribution, specifically targeted to hospitality workers who either lost their jobs or got their hours cut because of the pandemic. Bob Kaminsky is the Chief Strategy Officer for Feeding San Diego.
At last count that we saw, there were about 77,000 workers in this particular industry segment that had been displaced from work. So as a result, many of them have never experienced the need to reach out to others for help.
For hospitality workers like Shanice Scott, the ripple effects of the pandemic have caused economic hardship.
It's been really rough for me personally to maintain employment. I recently started working, and honestly, if I didn't come pick up this food, I honestly wouldn't know where my food would come from until I got paid.
The distributions will provide each household with 50 pounds of food, including frozen meat, produce, and dry goods. Along with the food, people are getting information on how to access Feeding San Diego distributions close to their homes, and about CalFresh, the state-run program providing monthly food benefits for low-income families.
I don't qualify for food stamps. I don't qualify for other food programs, so just to be able to have the opportunity to get some help with getting food, it makes a difference for me, really.
One more distribution session for this month is planned for next Monday, February 22nd. It will also be for people working in the hospitality industry, and attendees must register online at feedingsandiego.org. Kaminsky says Feeding San Diego plans to continue large-scale food distribution efforts in the coming months, including one in Legoland area for the general public. Jacob Ayer, KPBS News.
As we mentioned earlier, a delay in receiving new vaccine supply forced one of the county's super sites to temporarily close. The Petco Park location in downtown San Diego is our largest. It could reopen as soon as Sunday if new shipments arrive in time. It's the latest in a series of recent day-to-day closures caused by supply shortages and weather. Anyone with an appointment will be notified by email with details on how to reschedule. Communities across Southern California have super sites like this. Nicole Cornstalk shows us how nursing students are getting valuable experience in the Inland Empire.
Hello. Behind every COVID-19 vaccine, go ahead and take a seat. There's a friendly face waiting to give that life-saving shot.
How are you?
I'm great. How are you?
Doing well.
But at this vaccine clinic, some of the volunteers are still in school.
It's been a great opportunity to really try my skills and put it out there.
Arna Alyssa Gumangian is a nursing student with Loma Linda University.
So we're graduating June.
She's here because the San Bernardino County Public Health Department recruited nursing students from across the Inland Empire to help vaccinate people during the pandemic, to free up professional healthcare workers so they can treat patients in hospitals.
I'm happy to have it.
But Arna says some people look at them a little sideways when they set their eyes on that nursing student badge.
Yeah, sometimes they're like, oh, are you okay to checked off for this skill? I was like, yes, ever since first quarter.
Most definitely. A lot of people are quite anxious, but I just try to reassure them and let them know that they're in good hands. And you're going to want to leave this bandage on for at least a day or two.
Menzer Aberbeck says at first he was a little nervous to be here too.
That's in the back of your mind, like you're going to be exposed to a lot of people and you don't know where they're coming from.
But he also realized this was a once-in-a-lifetime opportunity.
To have a role in combating COVID-19, it gives you a good sense of purpose and being able to serve the community.
It can stay in the refrigerator, the Pfizer vaccine, for 5 days. It can stay at room temperature for just 6 hours.
Michael Hogue, the dean of Loma Linda University School of Pharmacy, says it's a race against the clock to get the thawed vaccines into thousands of arms per day here at this clinic.
We've given 15,000 doses and no significant adverse reactions.
And these students haven't wasted a single dose.
That's it.
Perfect, thank you.
You're welcome.
And that was Nicole Cornstalk reporting. In one of his first domestic trips as president, Joe Biden was in Michigan Friday to get a look at the work Pfizer is doing to manufacture vaccines.
It's not enough that we find cures for Americans. There needs to be cures that the world is able to take part of, because you can't build a wall or a fence high enough to keep a pandemic out.
The president toured the facility and spoke about his administration's goal to have the vaccine available to most Americans by the summer. This week, the Biden administration also took steps to allow more people to get health insurance by reopening enrollment through the Affordable Care Act for another 3 months. Despite the progress we've seen, there are still so many families dealing with the heartache of a loved one hospitalized with COVID-19. Michelle Gillet has the story of one family in Orange County and their musical support for their father and husband.
There is a very special reason a mariachi band filled a hospital parking lot with music.
Because he would have done it for me, and I beat him to it. And I know he loves me. Every year he does something like this for me, every year.
It is one way that Patricia Trejo could show her love for her husband, who has spent the last month at St. Jude Medical Center battling COVID. As the band plays here in the parking lot, Joseph Trejo is upstairs in an isolation room. He is very sick, and it's likely he's not aware of what's happening here. But his wife is hoping that he can hear the mariachi music and feel the prayers.
It's just unbelievable, you know. He's such a well-liked guy throughout our whole school district that we work at. And when she sent this out, she sent this mass text out on Friday, and I said, we got to be there.
Hospital staff whisked Patricia Trejo to her husband's bedside. She hasn't been able to get close to him for a month. A nurse held a phone near his face as the mariachis strummed their guitars. COVID has ravaged this Orange County family. The kids and parents were sick. Patricia's father died a week and a half ago. That same day, Joseph Trejo was put on a ventilator.
It's kind of sad, you know, like, I miss him. I miss my dad, you know, he's my father. I haven't seen him in a month.
I started to pray even harder, and then he opened his eyes again. So I know he heard me, and I know he heard the music.
And that was Michelle Gillet reporting. This week brought the arrival of Lent for Catholics around the world, but this year it looks a little different. KPBS reporter Jacob Ayer shows us the changes San Diego priests are making to keep their parishioners safe.
Ash Wednesday signifies the start of Lent for many Christians worldwide, and typically parishioners are able to receive ashes on their forehead, usually placed by a priest's thumb to mark a day of repentance. But this year is a little different for many churches, according to Father Peter Navarra at St. Joseph Cathedral.
The prayer called the prayer of repentance, the prayer over the ashes, will be said only once, and then the people will come, and we are using Q-tips to mark the cross on the people's foreheads.
The Vatican encouraged priests to offer the ashes with a contactless motion by sprinkling them on the top of parishioners' heads, but the Roman Catholic Diocese of San Diego chose to have all their priests use Q-tips to apply the ashes. St. Joseph Cathedral facility staff member Benito Gutierrez received his mark of the cross indoors.
Pues se siente bien porque es un día especial para los católicos.
Well, it feels good because it's a special day for Catholics. It reminds us that we have to believe in the gospel, repent, change our lives, and it reminds us that we are dust and we are going back to dust. Some churches in San Diego County announced they will forego the ashes entirely, while others are sending ashes in envelopes to their faithful to use during online services. But at St. Joseph Cathedral, Father Navarra says he's grateful to have indoor services again and is optimistic for the future.
I had the first vaccine. Most priests have had 2 vaccines. A lot of our people here are seniors. They already had their vaccines, including my deacons. They've had their vaccines. So I'm hoping that by Easter, I'm hoping that we will allow more people to come.
Under current rules, even with vaccinations, indoor church services remain limited to 25% of a building's capacity. Jacob Ayer, KPBS News.
And as we end the show, an update on some COVID-19 cases that got a lot of attention. Those gorillas at the San Diego Zoo Safari Park are back to full health. This week, the zoo announced the gorillas recovered from their bout of coronavirus and are ready for visitors. The 8-member troop had been out of view after getting sick in January, and during that time, they received care from experts in both human and veterinary medicine. Zoo staff believe the gorillas were likely exposed to the virus by one of its keepers. And a reminder, you can find all of your content on the Tracking COVID-19 page at kpbs.org. And in addition to our reporter stories, we're updating our live blog with the latest news and case numbers. That's all for this special edition of KPBS News. I'm Maya Trabulsi, and from all of us here at KPBS, thanks for joining us and stay safe.